Hospital in Your Home is an innovative program St. Luke's recently launched, allowing certain patients who would traditionally have been hospitalized to instead receive the care they need in the comfort of their own home. Congestive heart failure is the #1 diagnosis for patients admitted into St. Luke's Hospital in Your Home program. Thanks for joining us for this week's Health News You Can Use. I'm Stephanie Peplinski. During Heart Month, we are discussing how Hospital in Your Home specifically benefits patients with cardiovascular disease. With me today is Dr. Michael Nassif, cardiologist and medical director of St. Luke's Hospital in Your Home. Thank you so much for joining us today.
Yeah, thank you for having me.
So Hospital in Your Home is a new but expanding program here at St. Luke's. Tell us a little bit more about the program for those who have never heard of it before and how this helps patients.
Yeah, and so we've started July of last year. We've had 230 patients participate to date. And so these are patients that presented to the emergency room and were being admitted to the hospital. And instead of putting them in a regular brick and mortar hospital room, we transitioned them to home, and we are there in person twice a day, giving IV medicines, checking their labs, listening to their hearts and lungs. And then simultaneously, we're there virtually 24 hours a day, and we're able to do remote monitoring of heart rate, heart rhythm, oxygen saturations. For these patients, it really benefits them to be in a more comfortable environment, be around their loved ones, but it also gives us a lot of opportunities to see what the patient's home life is like, to see what their dietary habits are like, and able to go through their fridge, go through their pantry, help them create more healthy grocery lists. And so it's really been a great opportunity for both patients and the providers.
Talk about the benefit, too, for some of these elderly patients to be able to then stay at home and not have to go to the hospital every single time.
Yeah, and that's, one I didn't really consider is what a benefit it is in terms of their families. We had one of our patients talking about how her kids all had to take off work to come visit her, and it would interrupt all of her family's life. And by being able to stay at home, we're able to kind of keep them a little bit more in the normal routine. We do ask the patients for their sleep schedule, and unless there's an emergency, we don't bother them during their sleep schedule. We do schedule the day before when the physician's going to visit the patient, when the nurse practitioner is going to visit the patient, when physical therapy is. So the patients and their families actually know who is going to be there and when, and are able to be present and interact where it is helpful.
Great. And you had mentioned, nearly or almost 50% of the people coming through this program have congestive heart failure. Talk about why you're seeing so many of those patients and how this program is so beneficial.
Yeah, and it's the congestive heart failure is the #1 cause of hospitalization amongst Medicare patients, and it's predominantly Medicare patients we're taking care of. But it's also a really good diagnosis for the hospital in your home. So these patients often are congested and have way too much fluid in their bodies, and they just need IV diuretics to help get fluid out over a number of days. And so we're able to do that. We're able to check their labs in the home and actually get the results in the home to monitor their kidney function and monitor their electrolytes. And I also think having them being, ambulatory and around their house, as well as getting a full night's sleep, they seem to heal much better and do much better than they do in a brick and mortar hospital.
How do you see this program expanding here at St. Luke's?
Yeah, so we'll be really excited. In the next month, we're going to start taking some patients who are getting procedures such as a Watchman device or a mitral clip. They typically spend 1 or 2 nights in the hospital. And we now have continuous telemetry monitoring, so we can watch their heart rate and rhythms at all time. We've also upgraded our portal ultrasound services, so we can do a quick echocardiogram, or as well as look at the site that they had their procedure accessed at. And so we're planning to start admitting them to Hospital in Your Home sometime this spring, hopefully in March. And I think that'll be a tremendous benefit to patients because, lying in the hospital for even 24 hours is not benign to these 80 and 90-year-olds. And alternatively, we can have them at home and monitor them safely at home. Should be a win for everybody.
Absolutely. And as technology continues to expand, I think this program will have even more opportunity here. To learn more about Hospital in Your Home, visit stlukeskc.org/hospital in your home. You can also find updates on other health news at stlukeskc.org/news. Thanks for watching Health News You Can Use.